The broadcast is now starting. All attendees are in listen-only mode.
Good morning. This is Beth Seeloff from the Intertribal Council, and I'd like to welcome you to the Diabetes Prevention Program DPP pilot proposal for Michigan tribal communities. We'd like to start today. Our agenda includes introductions, supporting program success, program participants, the role and training for DPP lifestyle coaches. The program infrastructure will discuss the role of providers in this program. And of course, everyone's most important focus is funding and material, and then next steps. We'd like to start introductions. I will unmute the attendees. Betty, are you unmuted at this time? Let's see here. Okay, so I'm just gonna go through, unmute. Here we go. Betty, would you like to?
It's confusing trying to explain this to. Okay. It was confusing for me, and I asked Sheree why I had to do it. She's like,
Betty, would you like to introduce yourself?
You found it. I didn't say I did it.
Okay. Looks like Betty's not on. Gina, would you like to introduce yourself? Gina White, would you like to introduce yourself? Hello, Patricia. Would you like to introduce yourself? You'd have to unmute yourself. Would you like to introduce yourself or? Jennifer, would you like to introduce yourself?
Sure. My name is Jennifer. I'm an RN case manager at LVD Health Center in Waters Mead.
And what is your?
I've been in my role as a diabetic educator for 3 months here at this clinic.
Thank you, Jennifer. Betty, would you like to introduce yourself?
Sure. Thanks for unmuting me. I'm Betty Jenke from Bay Mills Health Center. I'm a supervisor case manager here at Bay Mills, and I don't know what else I'm supposed to say.
The role in the diabetes prevention or your interest in this program?
Very interested in a DPP program, and right now, my role in diabetes prevention more is for people who have diabetes, so it's an after role, not a before.
Thank you.
Yep.
Good morning, Kim. Would you like to introduce yourself? Anyone from Keweenaw Bay on?
Good morning. This is Kim McClare.
Hi, would you like to introduce yourself? Tell us what tribal community you're from, your role in diabetes prevention, and the interest in this program.
I am all new to this program. I'm 3 weeks into it. I'm a community health worker with the KBIC Health Systems in Berga, Michigan. So I'm here to learn and listen today.
Great, thank you very much. Gina? Well, Gina must have us on hold. I think we've got everyone. If I missed you, let me know. Oh, Sumit. Okay. Hello, Sumit. Would you like to introduce yourself?
Sure. Sumit Pindharkar, Health Administrator, Grand Traverse Band, Ottawa Chippewa Indians. And I just am interested in learning more about this program.
Okay, great. Thank you. Well, I think that is, we will be able to answer all of your questions today. And I'm going to begin by introducing Adam Russell from the National Kidney Foundation of Michigan and Hannah Wickern, the program coordinator at the National Kidney Foundation. The Intertribal Council and the National Kidney Foundation are partnering up to support Michigan tribal communities and eliminate disparities that could impact this program. So at this time, I'd like to give the floor to Adam.
Thanks, Beth. We also are unable right now to see the slides on our end. Not sure if that's universal, but there we go. Awesome. Thank you very much. Yeah, my name is Adam Russell. I'm the Senior Program Coordinator, Program Manager here at the National Kidney Foundation, located in Grand Rapids, and I've been working with Beth and other members of the Intertribal Council of Michigan just to talk about the diabetes prevention program and see if it's something that we can bring to communities in that area, and to do so in a way that brings some long-lasting change. So our primary goals in being a part of this discussion, as well as a part of this budding and exciting relationship, is to build some really deep and effective infrastructure for support of the diabetes prevention program in tribal communities. For us, that's really around capacity building and finding a way for us to provide support for the program in a way that is long-term sustainable. So the roles that we can play in making this happen in anywhere in Michigan, and has a lot of success in Western Michigan, mainly in the southern part of the Lower Peninsula. We can provide some in-depth lifestyle coach training, and we'll talk a little bit more about what that entails a little bit later in this webinar. We also have developed some culturally appropriate program materials, and look forward as a part of this pilot to develop even more culturally appropriate materials for the various communities that we would serve in your areas, and then also wielding our accounting and analytics team to provide some in-depth grant seeking and grant funding support to make this program happen. And yeah, excited to make it happen, excited to hear and understand everybody that's in this call, as well as other colleagues that may also have interest in helping us build capacity for something that we know to be just life-sustaining and life-changing. Beth?
Anna, would you like to start the discussion on the participants who can enroll in this program?
Yeah, sure. My name is Hannah Wickern, and I'm a program coordinator here at the National Kidney Foundation of Michigan. I really work to get the participants enrolled in the classes and then help them with, staying in the class, whatever barriers that they're facing. Before my work, I did have a small part in the Intertribal Council of Michigan, so that's kind of how we made the connection there. So I'm just really excited to be a part of this collaboration. But just kind of to dive right into the diabetes prevention program, on this slide here, we have just kind of the basics of who would qualify for this program. These are the CDC's requirements for participation. So they do have to be overweight adults, having a diagnosis of prediabetes based on a blood glucose test or an A1C. And they also cannot already have been diagnosed with diabetes. So just a quick overview on that one, and then we'll go ahead and jump into the next slide. So how this program is seen to be successful is by having these 5 main components here. So in order to be successful, we have to be sustainable. We can't just be bringing in a class one time and, you know, having it be a one-time thing. We really want to plan for not just this class that we are hoping to provide or, you know, get involved with, but also classes in the future. So two of the really main pieces are having those participants who want to take the class, you know, participants who are engaged, who are ready for change and are interested, and then also to have that lifestyle coach who can foster and facilitate a conversation around lifestyle change. In order to kind of have these two main pieces, we also need to have a program infrastructure, meaning that we need engaged providers who can help us find those interested participants. So we need, you know, we can't do it all. We need really a team to do this. So having those providers who know the participants who are at risk and being able to refer them into one of the programs is a huge piece. The next kind of step you see on here, the bullet, we also need to have funding. So we are actively going to be seeking out grants to provide this, you know, first step of the program. And then as your infrastructure kind of builds, you'll have other funding opportunities. In the first steps that we're talking about here, the funding being a grant will provide monies for the materials. And then kind of looking at what success looks like in this diabetes prevention program are looking at the two pieces there in that orange box. We have the two main goals being 5 to 7% weight loss of the participants. So one of the first two sessions, they get weighed in and they decide what their goal is for their weight loss, and that 5 to 7% is set by the CDC. And then the other piece is that 150 minutes of physical activity per week. So that is something to build up to. We're not asking our participants to start out with that number, but those are kind of the two metrics that we go by. But then also the success of the program really is to build a supportive environment for lifestyle change and to have the right people there to do that, meaning the lifestyle coach. So.
Yeah, and this is Adam again. I cannot stress enough the need for a universal community approach to the success of this program. So for that reason, we want to start small and targeted. We want to start in as many places as there are interests and as there is interest to build community support. So as Hannah touched on, the idea of having providers and physicians in place, community champions who are willing to take on the coaching roles, engaging participants at the level of where they are coming from and why they are at the place they are at in terms of their health. So for that reason, as we're seeking the funding, like we really are looking to find pilot and seed level funding that will allow us to build that sustainable infrastructure in as much as it will allow us to deliver the program. Just to reiterate, as Hannah was saying there, we only plan to come and be a part of this if we see and can find the support outwardly, you know, from funding sources as well as inwardly from community champions and health champions that are willing to figure this out with us. So yeah, thanks Hannah for sharing that.
Great. Our next discussion is around the lifestyle coach. And we did have a question on whether this provides certification as a diabetes educator. And this is a separate component from the diabetes educator program, so it does not provide certification as a diabetes educator. However, the lifestyle coach is one of the key components of this program, and as you know, successes often in programs are based on the leadership involved. And so Hannah's going to give us a little more information on the qualifications for lifestyle coach and the traits we like to see in that person.
Yeah, so the lifestyle coach is really one of the biggest kind of indicators of success of the program. You know, myself being a program coordinator, I like to think I do a lot, but it's really the coach who is talking with those participants every time they go to class and, you know, supporting them in a way that is non-judgmental. They're caring, they're empathetic, they really know how to listen, and they're a good communicator. But what's nice about the role of the lifestyle coach for this program is that you do not have to be somebody with a medical background or with credentials behind your name. You really just need to have a basic knowledge of you know, health and a little bit of nutrition and physical activity. So it does not have to be somebody who is a nurse, or if you are listening to this webinar and are interested and worried about who's going to take on this role, it doesn't have to be anybody in your clinic. It can be somebody who is a trusted community member. So somebody who is able to connect with, somebody that you are able to connect with, maybe as a clinic manager or somebody, but also that can really connect to the community as a whole. So that being said, if you do have somebody who's interested and does have a clinical background, they are more than welcome to be a lifestyle coach as well. One thing that I do say is that to be a lifestyle coach in this program, you kind of have to take off your medical hat and be able to just facilitate. So not having all the answers is okay, and if you do, kind of try not to answer every single question, try to more facilitate a conversation. So really anybody can be a lifestyle coach. We do provide a 2-day lifestyle coach training, which Beth actually just went through, so she can kind of speak to that, but it's not how to manage or prevent diabetes, it's more how to be a good facilitator. So we would provide that as part of the infrastructure building of this collaboration.
And I just want to remind folks, if you have a question, you can type it in the question box, and we will answer them as we go or answer them at the end of the discussion. So as we move on from lifestyle coach, we're going to talk about program infrastructure. And as you know, working in tribal communities, there isn't a single formula for success. And so as you look at this slide and you listen to the discussions, I hope that you will visualize what will support success in your community. In my first discussions with the National Kidney Foundation, I said we have barriers in these communities. We're in rural communities. We have economic disparities. We have structural barriers. And so the reason for discussion of the pilot is that we want to tailor these programs so that they're culturally appropriate, that we ensure that there's healthcare provider and patient communication, and that, you know, patient communication isn't just face-to-face anymore. As you know, there's texting, there's telephone calls, and in some, you know, rural areas, we're now going to open discussions with patients on Facebook Messenger, right? These social media messenger platforms, because it doesn't use their data. They can talk while they're on Wi-Fi. And so opening up these discussion lines is super important. And another big piece is convenient program locations, right? So where in your community is convenient for meeting and is welcoming, is private as you want, as you feel it needs to be, and also that we can utilize transportation resources within the tribes to bring folks to the meeting and return them home. And as Hannah's going to talk about on the next few slides, is the recruiting and referrals. So recruiting and referrals takes, that's a heavy lift with the clinic, right? That's where you want to get the provider and your clinic staff involved in recruiting and referral for this program. And then, as Adam stated previously, the funding and reimbursement. ITC is dedicated, along with National Kidney Foundation of Michigan, to get the funding for this program and ensure that tribes are reimbursed in a timely manner for lifestyle coach stipends, program materials. And so that is a big piece there. And of course, all of the data that is collected on patients throughout this program is going to be supported with HIPAA compliant data systems. And I'm going to turn this over to Adam for a moment to discuss the culturally appropriate piece of this program and how National Kidney Foundation has adapted this program for communities in the Grand Rapids area. Adam?
Yeah, thanks, Beth. Yeah, I would say this program really builds on its own success. And so it's not, as Beth mentioned, there's not a formula that we can just pick up and apply anywhere. Even locally and regionally here in the Grand Rapids area, as many of you know and where you live as well, neighborhoods have their own identity, they have their own personality, and so the program builds on its own success. We started this by doing 3 or 4 workshops a year. In Grand Rapids, we're now doing over 45 per year. Because we have built this very patient-steady infrastructure over 3 to 5 years, we've demonstrated support in very small batches first, followed by larger batches, followed by grant funding, followed by insurance-based funding. And so like in that mode, a key piece of that is making sure that we are speaking to the people that we are teaching appropriately. And so we take great care and great pain in, as we develop each new workshop, making sure that we identify that right coach champion, that if it's a different language we're teaching it in, that they speak that language, that they look like and act like and live in the community to which they are teaching. We had, as recently as 3 years ago, we had 0 traction in the Hispanic community, which is fairly large identified Latino community here in Grand Rapids. And like I said, as recently as 3 years ago, we had no identification there, but we started with a coach who had passion about the program, who understood the intent behind the program through both our training and then some additional training that we provided her. And then we used her insight and worked with her to say, if this is a program that's coming from the U.S. federal government that works in general with most people, how can we adapt it for people in the Latino community that may be from Mexico, that may be from anywhere in Central America, that could be an islander, all of these different cultures, how can we look at this curriculum and adapt it in a way that speaks to them? And we learn as we go. And every workshop that we do that is outside of the norm of the general population curriculum that the CDC provides, we write it out and adapt it. So food tastings, food examples, activities around understanding fat grams and calories, all of those things are adapted using culturally and community appropriate both language and food. So again, the key pieces of that are having that lifestyle coach that looks and acts and talks like the people who they are teaching, that understands sort of what is going on in the community, not just coming into the community as a teacher. And then all of the various examples around healthy exercise, around healthy food choices, around how to balance your plate, making sure that we're not prescribing something that is just outside of the realm. So, you know, understanding what the food supply situation is in each varying community is really important to us and to our success. Understanding that, you know, we don't provide, for example, here, you know, grocery stores as a necessary solution to some communities because they live in a food desert and it's, you know, it's outside of their transportation range to provide food in that way for their families. And so, like I said, it's a slow, steady process, but it builds on its success. And so we can get it right in this pilot phase in the very first sort of early stages, both at an infrastructure level as well as a very small programmatic sampling. we'll learn a lot, and we'll get a lot of great feedback from that lifestyle coach, from you as community members who are supporting the program, and that will lead to a couple more workshops and a couple more coaches who graduate from those workshops and are so inspired by the program, and it'll just continue to build and build, as it has for both our general population clientele here in the Grand Rapids area, as well as our Hispanic community, Latino community folks who've taken part of it. So we're always seeking, as the NKFM, we're just seeking the most right solution, and we're looking at each one of these anew, knowing that the general outcomes of 5 to 7% weight loss and 150 average minutes of activity will greatly reduce or even eliminate the diagnosis of diabetes in the future.
We had one question from Jennifer, and she asked if sites could have more than one lifestyle coach. And Jennifer, the answer to that is yes, and it is encouraged that you have a team of lifestyle coaches, so maybe 2 to 3 at each site, so that there is support within the community. So next we're going to move on to the role of clinic providers. And this is, Hannah's going to discuss the role of clinic providers and the recruitment. And this is where the baseline for recruiting and referring clients to the DPP program. Hannah?
Yeah, thanks, Beth. So the role of providers is bigger than we might think. Providers really give that information that patients hear. I don't think all the time providers realize how much influence your words have on the people that you serve. So you are able to, as a provider, not just being a physician, but also, a dietitian, a caseworker, or a home health person, anybody who can see these participants, or excuse me, these people before they're participants, and are able to identify them. And we just, the biggest part is talking to them and letting them know that they are at risk for developing type 2 diabetes. So that alone is just huge. And then we also, the referring piece is just referring them to a program. And what's really nice with what we have here at the National Kidney Foundation is that providers do just that, and then we kind of take over from there. So if National Kidney Foundation were to work with this population, we just ask that you send them our way, and then we kind of take it from there and reach out to the participants, see what might be available to them. So I hope this doesn't seem like another thing that you have to add onto your list of tasks for the day. It's just really identifying and talking. And then if we move on to the next slide here, we just have a couple of examples of passive tools that we use here in the Grand Rapids community. Obviously adaptable, if this were to be in your neck of the woods. We do have the little prescription pads on the left there. It's real simple. You check off why they might be at risk. Maybe it's their glucose, maybe it's their A1C. And then you just have to sign your name. And then obviously put the patient's name in there. It doesn't get them to us to contact them. That's why it is a passive tool, but it does give the patient our information, and then they can contact us if they are interested in seeking out change. On the right side, we do have, it's just like a little pamphlet that you could stick in your office. It highlights if you might be at risk, and then gives them information on how to contact a workshop that might be near to them. So just a few examples of tools that you can have at the office. The prescription pad we've noticed is really helpful as just kind of a, here you go, here's something to take with you. And they really see that as something that you as a provider, as somebody who is highly influential, are giving them to do. So really, really great tools here.
Yeah, and it all again highlights the partnership aspect. So as Hannah said, it's not the brochure alone, and it's not the prescription pad alone that do that. But if they have that in their pocket, and their doctor says you're going to get a call from somebody at the NKFM or the ITCM about this upcoming program, and then we give them a call or they get a call. All of those things together build the case in their mind that, hey, maybe this is something I need to focus on and work with. And again, all of these tools were created in collaboration with community members and with physicians in mind. And we'd be happy to do the same as we move into, again, building the infrastructure out for this program to look and see, like, what are the culturally appropriate tools in terms of language intent, in terms of, you know, simple things like the area code that they're calling, or any of those things. We have a team of folks that can help build this infrastructure on our end, and would look to collaborate with folks on your end to get the most right tool out there.
Yeah, and I just want to reemphasize that, you know, if counting on the patient to call you back for, you know, participation may not be the best fit, then we just adjust and the clinic reaches out to the patient as a follow-up to the physician. So again, this being a pilot, we can tailor this any way that you feel best, works best for your specific community. It's not a one size fits all. What works in Bay Mills may not work in Keweenaw Bay or Grand Traverse Band. So that's why going in this as a pilot, we have a lot of flexibility to build a sustainable infrastructure. So the next piece that is always an important part of any program is funding and materials. So this program is going to be supported by the Comprehensive Cancer Control Grant, but for the purpose of the pilot, we are going to reach out. Both ITC and National Kidney Foundation of Michigan are going to partner in securing funding that will support lifestyle coach training, travel for training. Under the lifestyle coach program, each session that the lifestyle coach teaches, they're provided a stipend. And am I correct, Adam? Could you tell me what the current stipend is per class?
Yeah, it ends up being about $10 an hour, assuming about 4 to 5 hours of work over the course of any given week that they're preparing for a workshop. So $50 per workshop is the simple way to say it.
Okay, great, thank you. And then this grant would also support materials and then participants for the participant materials and incentives. And can you kind of talk a little bit, Adam and Hannah, about the participant materials and incentives?
Yeah, so when participants enroll in the program, they do get a few things. So you can kind of see on the right-hand side, we do have a binder that they get, and each week they'll be provided with a new lesson. The lifestyle coach will hand those out each time that they meet. They'll also be given a few other things like the Calorie King book that you can see in the picture. They also, let's see here, you're able to get scales at a certain point. So I think it's session 9. If you reach session 9, you're eligible to get a scale to take home with you. What else? Tracking. Tracking is a big one. We provide a booklet for keeping track of your foods each week. So it's kind of like the homework piece of the program. Also, let's see here, the incentives. We rely on, like donations, but we also have, we can write incentives into the grant if that's something that you see would be helpful in retention or just getting people to the table.
We found a lot of success thinking about incentives not as incentive to participate or incentive to lose weight, but really as a hand up in the program. So we've created a series of contacts that we have, and I'm sure there's more that you have in your various communities, by which we get various cooking tools or kitchen-based aids or things like that. And, as it makes sense. So as the entire class loses X amount of weight, we'll hand out like a calendar, or if, everybody completes a full tracker, but really thinking about incentives as ways to encourage the positive behavior that's required, the positive lifestyle change behavior that's required in the program. We found a lot of success there. So yeah, as Hannah mentioned, if that is something that your particular community is interested in and or you think might help engage people to participate, that's easily something that we can, either seek through donations or, add to our funding ask.
And the participant materials, so, as Hannah discussed, the program supports weight loss and physical activity. And that weight loss, if some of you are unfamiliar, is the program really focuses on counting fat grams, and where these food trackers come into play and where this Calorie King comes into play is that they utilize these tools to track their food. And then as the program progresses, they receive trackers to track their physical activity. So it provides them ways to be accountable to themselves, and also for you to see where the gaps are in their progress so that you can support them individually and not only as a group. The other piece that the grant will fund is we will get, if needed, we will get funding to support transportation for participants. And then of course the data support and data processing, which would fall under the National Kidney Foundation. And as we move forward in funding, the Medicare, right? Medicare or Medicaid?
Medicare.
Medicare does do reimbursement for this program if participants, they don't do it right at the start, but I think it's about week 9, you stated?
They do it at the start and then after week 8 and then after the year.
Yeah, so there is some reimbursement through insurances. So our next, go ahead. Go ahead.
I was just going to add, that's not something we'd really have to worry about in the pilot phase, but as the program becomes more sustainable and you'd like to move away from grants and more into other funding sources, that's where you really want to look into who covers the program and how can you get more people on board who will cover the program.
And as we've been emphasizing throughout this discussion, we're not in this for like a one and done program trial. The purpose of the pilot is to build a sustainable program that supports your community for the long term. So we're not going to just go in and say, here's your pilot and then back out. We're committing to this. Both the Intertribal Council and the National Kidney Foundation is to support this so you can sustain this program on your own in the following years. Again, if you have any questions, please type them in the question box and we'll move on. So the next steps for this is we need buy-in from stakeholders, and the stakeholders are you, the tribal clinics, and the tribal communities. And once we identify those that are interested in this program, we will identify the partners and get with you and identify the specific needs for your communities, and then assemble a diabetes prevention program working group. We're not going to drag this out and, maybe come summer we'll get funding. Our hope is to identify tribal communities by the end of the month, maybe the 6th of January. And then by the end of January, get a working group together, and by February, identify some funding sources. If you have questions, you can type them in the question box. Is there any interest, questions, or concerns that we can address? Again, you can put the questions in the question box. I will try to unmute you all. Let's see how we do it.
And then Beth, too, if I can add, that working group is really going to be people who are going to work with us on providing feedback and also setting up that infrastructure so that we know that we're going in the right direction.
Pretty much every door in the, yeah. Yep.
Oh, sorry. I was just saying that, that working group is really going to be somebody who is committed to providing us feedback and helping us as we, set up this infrastructure, because we definitely want to get it right the first time around and be able to, set it up in the way that is most appropriate.
Yeah, and so if that's you, that can be you really on any level. So if in your mind right now you're thinking, I know a couple of positions that we should meet with, that's great. That's a great way to insert into that work group. If you know that community member in your community that's just going to be that most ideal lifestyle coach, awesome. Like, we'd love to have that input in that work group as well. If you are excited from a nutrition standpoint and want to look at the curriculum as it stands now and how it might be adapted, again, another way that you can really join us in that working group. As little or as much time as you can provide will only help us inform the most right product that we roll out in this pilot phase. And so whatever that is for you, whatever that expertise or inspiration is for you, I would say opt in first, and then we can figure out sort of timeline and amount of stuff that you can help us provide.
Yeah, so just to reemphasize, this program, I encourage you to think about this, maybe ponder who would be the best, who you would nominate for lifestyle coaches in your community, or who you think would be a good advocate to identify any barriers that we'll need to address for this program to make it a success. I think addressing the barriers on the front end is going to support success at the end, and make sure that we have a successful program for all the participants who want to be a part of this group. So we don't want to limit it to 15. If there's more than 15 in one tribe, then we set up to work, 2 groups. We're going to make this work for you. And I also encourage you, involve your diabetes educators. This is a great program to partner with your diabetes in Indian country grants and funds and support personnel. And if you're a grantee for good health and wellness in Indian country, this supports that. And of course, this program does meet the activities and objectives of the Comprehensive Cancer Control Grant in improving health outcomes in cancer survivors. So there's no limit to where you can take this. All we ask for is your input and support. Let's see, we have another question. My providers are very supportive of diet, and I would absolutely love to participate. Running an 8-week. Okay, great, we have somebody in. So we have one, I know we have 2 tribes that are very interested in this. So what I do ask is that you all have my email. It's bclof@itcm.org, and just shoot me an email. And if there are any other questions, you can type them in the question box. Otherwise, you can send me an email. Hannah, Adam, do you have any other comments?
I think that's everything. I just really want to say thank you for everybody who listened in today, and we really appreciate any feedback that you can provide, even if it's not in a working group role. We just love to hear from you and know how to best support this program.
All right, we will have this recorded, and you can re-listen to it or share the recording with your colleagues. And again, if you can get with me by the first week of January on your interest, that would be great. And again, thank you all, and we'll talk to you again soon.
Thanks, everyone.
Thank you.